Hi, I am Dr. Tan Yia Swam of Breast Friends Surgery and Wellness. I am a general surgeon in the private sector and I used to hold a position as the president of the Singapore Medical Association. So I'm here today to introduce to you the complexities of the Singapore healthcare system. So in Singapore, the healthcare system is broadly divided into the public sector versus the private sector. In the public sector, that's what you know as the restructured hospitals, such as Singapore General, NUH Hospital, Tan Tock Seng, etc. There's also whole systems of polyclinics to back up the hospital system. In the private sector, this would be divided into primary care versus tertiary care. Primary care would commonly refer to the GPs that you find under HDB block estates or maybe in the shopping malls. Tertiary care would refer to specialists, which are commonly found in the private hospitals. A common analogy would be food is an essential resource, isn't it? And you can choose to eat at home, at a food court, in a restaurant, or go to a fancy omakase. So likewise, healthcare is an essential resource. You can choose to self-medicate at home, see a restructured hospital or polyclinic, or pay a bit more to see a private GP or specialist, or if you're really fancy, go to some really super fancy famous doctor, and that's your omakase. So how do you decide where to go? A lot depends, first of all, on your own personal finances. How much can you afford? This is reality. Number two, if you have bought a private healthcare insurance, know your coverage so that you know what you're entitled to. So for all Singaporeans and PRs, be aware that you actually have access to MediSave and also MediShield Life. MediSave is a national compulsory savings that all Singaporeans and PR have, and you can use it for various small things, but there's a lot of limits to it. Number two is the MediShield Life, which is again a national insurance which is very comprehensive and covers any age and even conditions that you're born with. However, as many of us would experience before, certain conditions need a longer wait time. So one other option that some of us would go to would be the private sector. The most common one is the so-called hospitalization plan, which is also called your integrated shield plan. The integrated shield plan is tied to MediShield Life, and there are 6 providers. A different kind of insurance would be the so-called corporate plans, where your company helps you into a group plan. So the problem with that maybe is that if you leave the company one day, that plan lapses and you don't have any additional coverage. So for most working young adults, I would assure them that they should be able to pay for private care if they want to have a faster, more personalized access to a doctor in the private sector. The management of increasing healthcare costs comes in many different ways. One of the ways is by insurers, who are also called payers, who will have a certain contract with their panel doctors, and there's a pre-arranged, agreed-on fee. So whether or not I'm on your panel, it will affect how you get reimbursed for your claim. So to give a real-life example, I have a patient, let's say Alice, who sees me for a breast lump, and the total bill for the surgery to remove it may be $10,000. If I am her panel doctor, all she needs to send in some kind of pre-authorization form. If the company approves it, she just needs to co-pay 5%, which works out to be maybe $500. Whereas if, let's say, she chose me, a non-panel doctor, then that's when she'll be a little bit more uncertain about the coverage. She might have to pay the first $3,000 upfront, and she might have to co-pay 10% of the remaining bill. So it really depends on your coverage, your panel doctor or non-panel doctor, and do speak to your agent to understand better how much do you have to pay. So if I were to become a patient and try to choose a doctor, what are the things I consider? Well, first of all, honestly, it's still whether I trust the doctor or not. It may come by through word of mouth recommendations from my friend, from my family, or from my GP. Then when I actually meet the doctor, I would ask him about treatment advice, treatment options, and if I do need surgery, what is the breakdown of the cost. Having that number in mind, I can then take it back home and discuss with my agent to better understand, is this doctor on my panel or non-panel? If on panel, what are the costs that I have to pay, versus if the doctor is non-panel, what do I have to pay? If I'm able to afford the co-payment and I trust this doctor, I will go ahead. Second scenario, I like the doctor, but yikes, the co-payment is too high for me, then it's very sad, but I might, a bit embarrassed and ask the doctor, I'm so sorry, can you recommend me somebody else? And I would trust this doctor to refer me to somebody else on my panel that he would transfer my care to. So in my practice now, I realize I receive patients from multiple sources. So what do I help the patient with in terms of making a decision for surgery? First and foremost, I would just prioritize the patient's medical needs first. What is your condition? What do you need? And what's the treatment necessary? And breakdown of cost. Number two, if the patient is comfortable to share certain financial details with me, that would be great if they take me into their confidence. Likewise, if let's say, oh no, sorry Dr. Tan, I really like you, but you're not on my panel, are you able to recommend a panel doctor for me? I will take the effort to look through the list of panel doctors and find a few doctors that I personally know and I will highly recommend. So I would urge all patients to not be shy, right? Be upfront and honest with your doctor so that we can help you to get the care that you need.